So, go ahead, ma'am.
Good afternoon, everyone. I am Dr. Keerthana, consultant and fertility specialist at Oasis Tolichowki. Today, I am here to discuss about obesity, which is the most common medical condition causing infertility issues in men and women. As we all know, these days obesity now it's a pandemic and it is an epidemic in India. Around 20% of 20 to 25% of the men and 30 to 40% of the women in the reproductive age group are obese. Not only in the reproductive age group, the other important thing is that there is an increase in the incidence of adolescent and childhood obesity as well, because of which more and more number of obesity cases are seen in the early reproductive age group of both the men and women. And so this prevalence of obesity is also very high in the infertility cases as well. And what is obesity? It's basically a disease of excessive body fat, and which increases, this obesity will increase the risk of common medical conditions like type 2 diabetes, hypertension, dyslipidemia, endometrial cancer, cancer breast, and the other neurological conditions like stroke, osteoarthritis, obstructive sleep apnea, and most importantly, yes, there is an increase in the incidence of or increase in the risk of infertility. When a obese woman gets pregnant, in pregnancy, these women, they have an increased risk of having gestational diabetes mellitus, hypertensive disorders in pregnancy, preterm births, and there is an increase in the incidence of operative deliveries, that is increase in lower segment cesarean sections as well. So, when we talk about how do we estimate obesity now, so it is by means of calculating what is called as a body mass index. So, how do we get to this body mass index? Is it's nothing but your weight in kgs upon height in meter square. This body mass index, it has a normal range of around 18.5 to 24.9 kg per meter square. Anything or anybody with a anyone with a body mass index less than 18.5, we call them as underweight, and anything above 24.9, they are overweight, and above 30 kg per meter square falls under the category of obesity. So, according to the BMI ranges, that is from 30 to 34.9, it's class 1, or 35 to 39.9, it's class 2, and then anything above 40 we call as morbid obesity. The other way to estimate obesity after the body mass index is that by the estimation of what is called as a waist circumference, which ideally, if a man has a waist circumference of more than 1 or 2 centimeters, or a woman has a waist circumference of more than 80 centimeters, then they are said to be obese. And the other one is the waist hip ratio, which is above 1 in a male and above 0.85 in a female, falls under the category of obesity. And now, after understanding how common the obesity is, or what are the medical conditions that are aggravated by this obesity, and how to estimate BMI, and how to estimate the obesity. Now, let's discuss the most important topic, that is obesity and its relation to fertility or infertility as such. So, basically, the basic reasons for infertility in these obese women include, initially, I'll talk about in a female, its effects, and then I'll discuss in a male. So, in a female, the reasons for infertility, the primarily one being the menstrual cycle abnormalities. In obese women, there is a risk of anovulatory infertility because of untimely ovulation. These women have ovulatory dysfunction leading to amenorrhea or oligomenorrhea, and the risk, in fact, increases with the increase in the degree of overweight or obesity in adolescent and uh, or the adulthood. So, obesity, it is a common clinical feature of a woman with polycystic ovarian disease, which is seen in around 30% of the women. And what is the reason for the menstrual cycle abnormality or anovulation? It is the common reason being that because of the increased androgens, that is hyperandrogenemia, or increase in the aromatase enzyme in these women, in the obese women, there is excessive production of the sex steroids like estradiol or the estrogen, because of which the normal negative feedback systems, they will get altered, leading to the altered GnRH pulsatility, thereby causing anovulation. And the second reason, if we look after menstrual cycle abnormalities, is the ovarian response during controlled ovarian stimulation. That is during ART treatment, be it an IUI or an IVF, in women with increasing obesity, there is a risk of having decreased response to the ovulation induction agents that we give, like letrozole or clomiphene. And there are also they are at risk of having decreased ovulation rates. In IVF, these women, they will require increased dose of gonadotropins, or the increased duration, the number of days these women require these injections will quite be longer, or there can be fewer follicles that will develop at a given gonadotropin dose. And these women, they are at more prone to have a risk of cycle cancellation, and they are at risk of having few number of oocytes that get retrieved. And etiology, what for any of these being altered or abnormal in these women, is because of the altered folliculogenesis or the oocyte quality abnormalities. And then in women with obesity, there is also increase in the risk of having increase in the levels of insulin and leptin. That is, there can be lipotoxicity mediated damage can occur in obese women in their oocytes, leading to the lower rates of implantation, clinical pregnancy, and the live birth. And the third reason after menstrual cycle abnormality and abnormal oocyte quality, because of a poor quality embryo that these women produce, there can be again a lower chance of implantation. And the poor embryo quality is again because of what is called as a lipotoxicity. And the reason for the and the fourth reason is because of the impaired endometrial function or the altered endometrial receptivity, leading to what is called as a decreased implantation. Again, in these women, the abnormal placentation or the altered or the impaired endometrial decidualization can lead to the increased in the risk of miscarriage, or a woman is at more prone to have the obese woman is more prone to have that what is called as a recurrent pregnancy loss as well. And obesity can have not only lead to infertility by these various mechanisms, it can also have its deleterious effects on the maternal and the fetal environment too. That is, that is a obese woman during her pregnancy, as we discussed prior, she is more prone at risk of of having gestational diabetes mellitus, hypertensive disorders in pregnancy, increased risk of preterm labor, increased risk of operative delivery, increased risk of stillbirth, large for gestational age, and then there is increased need for a neonatal NICU admission in these infants as well. And transgenerational effects are that in the offspring is at increased risk of having metabolic dysfunction, and uh, and if the obesity is seen in the childhood or in the adolescent period, they are more prone to have an early type 2 diabetes mellitus, cardiovascular disease, and there is an excessive catch up overgrowth is seen in these children as well. And then when we talk about after a female, what are the issues or in a male, when we discuss about the obesity in male infertility, as we discussed, like how in a female the obesity is a risk factor for an in men to cause cardiovascular diseases, type 2 diabetes, various cancers, or there can be accelerated aging or neurodegeneration, and then it has a negative impact on fertility. And when we look into the males of fertility, when along with obesity, when there are additional risk factors like smoking or consumption of alcohol or this excessive nutrition, psychological stress, sedentary lifestyle, physical inactivity, and usage of some drugs, they mediate the obesity via the systemic inflammation, and because of this insulin or the leptin resistance, and thereby causing what is called as a elevated scrotal temperature, because of which the normal spermatogenesis process gets altered, and there can be erectile dysfunction because of excessive estrogen because of the aromatase enzyme, as we discussed prior. And there can be altered seminal parameters in these obese men, that is, there can be decrease in the semen volume that they produce, decrease in the concentration, and decrease in the motility, and then the decrease in the normal forms as well. And there can be an these men are also at increased risk of having what is called as a sperm DNA fragmentation. That is the intact chromatin, the intactness of the chromatin in the sperm gets damaged because of the obesity again. And there is, these men are at increased risk to have germ cell apoptosis, because of which there can be alterations in the seminal parameters. In males, obesity and metabolic syndrome, they are usually associated with hypogonadism as one of the feature, thereby increasing the risk for infertility, and it will perpetuate the underlying mechanisms of obesity induced complications. So after knowing about how the obesity in fact leads to infertility issues in men as well as women, then if we discuss about the management, the first and the foremost important is a lifestyle modification. That is, be it a male or be it a female, the optimal diet. First, when we talk in a lifestyle modification, first let's talk about diet, and then let's talk about the physical activity. When it comes to diet, the optimal diet, such as a Mediterranean diet, which improves the obesity associated metabolic derangements, and also there can be improvement in the oocyte and the semen quality as well. So what does this diet include? That is, it includes increased intake of fruits, vegetables, favorable fatty acids, that is unsaturated and omega 3 polyunsaturated fatty acids, whole grains, fiber, foods which are rich in antioxidants, micronutrients, and the other phytochemicals, which are usually obtained from fruits, vegetables, seafood, oil, nuts like walnuts, and some important seeds. And when coming to the physical exercise, that is 45 minutes to 1 hour, an hour of moderate to high intensity exercise, which includes something like not simple walking, but something like running, jogging, and then skipping, cycling. So it will induce in a male a rapid increase in the testosterone through increased pituitary activity. Thereby, there can be an improved Leydig cell function and decrease in the testosterone clearance. So, one way this physical activity and how it improves the seminal parameters because of an increased because of an altered production of the testosterone, and the other is by physical exercise also improves sexual function as well. And when we talk about after the lifestyle, improving the diet and then the physical activity, the other medical management, it is only beneficial when it is used appropriately with the lifestyle interventions. Again, these medical interventions, they act temporarily by its effect on the appetite, so that the patient must reduce the energy intake or increase the energy expenditure. So, in a medical management, it includes drugs like metformin, which will decrease the insulin resistance or increase the insulin sensitivity. And the other medical management, the other drugs like the commonly used orlistat, which is a lipase inhibitor, or liraglutide, which is a GLP-1 receptor agonist, are also used in cases of severe or the morbid obesity. And the less commonly used ones are the ones with phentermine, or the phentermine with topiramate. And next, coming to what is called as surgical management, it is most effective when the in cases of morbid obesity, that is when the BMI is above 40 kg per meter square, or when the BMI is above 35 kg per meter square, and when there are some associated medical comorbidities that we have discussed. Usually 70% of the weight loss will be seen 12 months after surgery, and 50% of the weight loss will be maintained at 5 years because of the surgical management. And the advantages being the resolution of hypertension, dyslipidemia, type 2 diabetes, obstructive sleep apnea. The resolution is usually seen in more than 60% of the cases. And the menstrual cycles, they get regularized, and the ovulation rates improve, and thereby increasing the chance of having a natural conception as well. But during the pregnancy, there is this decreased risk of having gestational diabetes, hypertensive disorders, macrosomia. But the disadvantage with the surgical management is that there is increased risk of short for gestational age, preterm births, and the neonatal morbidity and mortality. Hence, pregnancy is usually contraindicated for 12 months post bariatric surgery. And when coming to the ART treatment in these obese women, if her ovarian reserve is good and her tubal patency is demonstrated positive, and the seminal and there's no male factor, the ovulation induction medicines, along with the commonly prescribed metformin, usually improves her chance of ovulation. And depending upon the number of active married years and type of infertility, either a ovulation induction timed intercourse or an IUI cycle can be attempted in these women. But in a woman with low reserve or an advanced maternal age, or there is some tubal factor or a severe male factor, we emphasize we switch over to the other ART treatments like IVF and ICSI in these women to increase the chance of having a pregnancy. And this is all about obesity and its effects on fertility, and how obesity causes infertility in a male, how it causes infertility in a female, what are the management options, including the lifestyle, the diet, and the medical and the surgical management. If you have any questions, you can type in the chat box. I'm free to answer. Can belly fat affect pregnancy? Yes, because there can be problems in terms of absorption of these subcutaneous injections. There can be increased dose, duration of need for these injections. So one of the marker for these obesity, the visceral obesity, or the waist circumference, can definitely affect the pregnancy rates. by the absorption of these medicines or the gonadotropins particularly. Miscarriage, yes, obese women are at increased risk of having a miscarriage, unexplained miscarriage, as well as a recurrent pregnancy loss. And in fact, obesity also increases the risk of having a euploid miscarriage in a woman as well. That is when a woman has an euploid embryo that got transferred and her pregnancy test is positive, she is at more risk to have a miscarriage as well, even though the embryo factor is ruled out. Can obesity cause a bad quality sperm? Yes, because of an, as discussed, because of what is called as a increased aromatase enzyme, or there is altered scrotal temperature because of the obesity factor. The spermatogenesis gets altered because of the temperature changes, and it can have its negative effects on the semen volume, the concentration, the progressive motility, as well as the morphology. And because of the increased DNA fragmentation and the germ cell apoptosis, obesity is one of the risk factor for having a bad quality sperm as well. There are no further queries. Thank you so much.